Hi, my name is Emily Nguyen, and this presentation is for Public Health 127, Summer Session 1, 2019. I have selected to research and do my proposal on Nike, particularly in the United States. My mission is to maintain a workplace that practices and promotes a healthy lifestyle. Nike is an American multinational corporation that is engaged in the design, development, and manufacturing of footwear, apparel, equipment, and accessories. However, their main product are sports shoes. The company was founded in 1964 by a former track and field coach and his student Phil Knight at the University of Oregon. In 1966, they opened their first retail outlet, and in 1972, they launched the shoe brand. In 1978, the company's name was changed to Nike. The shoe brand became very popular in the 1980s and diversified its products and made more than just shoes but also sportswear and accessories as well. With the advancement of technology in the 21st century, Nike also transformed its products and began to sell sports technology accessories such as portable heart rate monitors and high-altitude wrist compasses. With such a large company, Nike has to have a lot of employees working for them. As of right now, they employ 73,000 employees worldwide. The general job categories are corporate services, design, manufacturing and engineering, marketing and communications, merchandising, product development, sales, supply chain, technology, and retail. The United States is a country with 307 million people. Their life expectancy for males is 75.65 years, for females it's 80.69 years, and their labor force participation is 154.2 million people. The unemployment rate is 9.3%. The healthcare system in the United States is non-universal and it doesn't offer universal healthcare coverage. It has been specifically designed to provide high-quality healthcare services for more than 300 million U.S. citizens. It is also a combination of private and public government-funded healthcare, and many individuals obtain healthcare benefits through their employers. Some of the data and stats of the United States is that 23% of adults report no physical activity. 1 in 5 American adults smoke. 30% of adult current drinkers report binge drinking. The top 5 risky lifestyle behaviors is poor nutrition, tobacco use, excessive alcohol consumption, overweight and obesity, and inadequate amount of physical activity. The top 5 leading causes of death is chronic lower respiratory disease, accidents, stroke, heart disease, and cancer. The culture and mentality of the United States focus on 3 core values, and their values are individualism, ambition, and freedom. These values are responsible for the motivation individuals display in changing health behaviors. The work culture is very prominent in the United States. As you saw on the slide before, a large percentage of American are employed. So their working hours are very long, which leaves little leisure time for physical activity. And many people tend to work 2 or 3 jobs. Since their hours are long, they don't have a lot of time to cook nutritious meals for themselves or their families, so many people tend to resort to fast food and processed foods rather than eating a healthy meal due to its convenience, which may lead to serious health consequences and complications. The CEO of Nike is Mark Parker, and he's a businessman that serves as the president, chairman, and chief executive officer of Nike Incorporated, and he's also named third CEO of the company in 2006. His contact information is not public, and due to a high volume of student inquiries and unable to respond to individual requests for information. However, I did go on their website and I found the Nike website, and their address and phone number is listed below. To start with the interview, I would introduce oneself as a student who is researching and interested in learning about workplace health promotion programs and had questions regarding their company. My goal is to schedule a meeting with a person with knowledge in employee health and programs. The goals of implementing a workplace health promotion is to provide on-site medical care and counseling, which will allow employers to seek professional health guidance, lower absenteeism, and reduce overall medical care and pharmacy costs. It's also to encourage and educate individuals to take responsibility for one's health and to help reduce risk behaviors for a healthier and happier workplace. And it also to encourage physical activity. Why is implementing workplace health promotions important? It's important. It's an important setting for a health protection promotion and disease prevention program because full-time working Americans spend more than 1/3 of their day and 5 days a week at work, which it allows. Since most people already spend their days at work, they can also have time to fit in physical activity during breaks or when they are stressed. The use of effective programs can reduce health risks and improve quality of life, reduce the risk of obesity, and promote healthier lifestyle behaviors such as healthy eating and physical activity. Nike, even although already it's a active company, and since it already promotes like sports, it's also recognized for being a top 10 company with incredible office health and wellness zones. Employees already have a fitness center and they have access to the company's original fitness center, which features weight rooms, yoga studios, and a cross training. Implementing work programs are also important because it can help with healthy behaviors, which would reduce the risk of health risks and then also reduce the risk of chronic diseases, which saves the company money and the employer money as well. On this slide, there's more benefits on why implementing a work health promotion program is important. So for the company, it can reduce health risk costs, it can increase higher engagement, improve productivity, reduce absenteeism, higher employee satisfaction, and positive influence on the company culture. For the employee, it helps it makes the employee healthier and more satisfied with their jobs, help people adopt and maintain healthy behaviors, lower health risks which leads to less chronic disease, reduce healthcare costs, and boost one's self-esteem and confidence. Earlier in the previous slides, we mentioned the U.S. health risks and systems, but Nike has its own healthcare system, which will help a lot of their employees. So Nike provides their own health insurance that covers their most basic and complex medical procedures. They don't offer health plan incentives, but they do offer a dental and vision plan. And it has a healthcare spending account available for team members. These funds are tax-free and can be used for medical necessities. So within the Nike workforce, stress is a large issue and can contribute to chronic diseases. As of 2017, there are 5,147 occupational injury deaths in the U.S. 40% of the adults went to work sick, 30% of adults who worked 41 to 50 hours per week were under stress, and 25% of employees felt run down and drained of physical and emotional energy. At Nike, they're a more diverse company than most other sports companies, such as Under Armour. Nike Sport is more diverse, and women make up 48% of Nike's global workforce. However, some risk factors for working at Nike is long work hours, working under pressure due to deadlines and limited time, not having enough time to eat healthy, and not enough time to be physically active. Also, stress. So some goals for my workplace health program is I want to help decrease stress and increase worker satisfaction and worker productivity. I want to promote the importance of physical activity, promote the importance of nutrition, reduce costs associated with expensive hospital visits and other healthcare costs by offering clinics, reduce the time that employers will leave the workplace to receive care, and motivate individuals to pursue healthy behaviors to reduce the risk of chronic illnesses. Some survey questions that I implemented was how often do you call in sick to work due to fatigue and lack of motivation or energy, and how many hours are you able to exercise a week? Many people in the United States don't have time to exercise just because they're so busy with work or school. So this is an important question just to help reflect on your life and to show the importance of physical activity. So one health product that I wanted to implement is health screenings. So what health screenings are is like you take a test at like a health clinic or an on-site clinic, and it tells you, and it can help detect like early diseases that you might have. And health screenings is the process of identifying healthy people who may be at increased risk for a disease or condition. It refers to the simple test to identify people who have a chance of obtaining the disease or is in early stages. It is important because if found early and detected, it will be easier to treat, and it also costs less than finding an actual cure. Some illnesses that can be detected through a health screening include high blood pressure, high cholesterol, diabetes, thyroid conditions, bowel cancers, and early breast disease. WHO states that 80% of premature heart disease and strokes can be preventable if detected by a health screening. And it is also important to include health screenings in the workforce so that employees are aware of their health and can also talk to a health coach or use on health clinics. So my design for implementing in Nike is I want to implement on-site work clinics and on-site health coaches for employers' convenience. So a health coach is basically a coach who you would sit one-on-one, and they will counsel you on like your physical activities, what you need, your nutrition, and this way the employers are able to understand what they need to help with and what more they need to do to maintain a healthy and balanced lifestyle. This clinic will also provide health screenings for each employee. The employee is assigned to an on-site health coach where they can get advice on fitness plans, nutrition, and how to balance a healthy lifestyle. The employee must also get an annual health screening and schedule a meeting to follow up with a health coach so that they are able to discuss the results and how to improve their lifestyle behaviors. The clinic is also a place where employees can seek care and treatment, and it saves time to rather than commuting to like a hospital or another clinic, and it also saves money. And here we will use an incentive-based approach to get employees involved and motivated to get checkups and schedule meetings. So we will gather points for each time they meet with their coach and offer rewards for a certain amount of points. This will allow the employees to want to go more than once. So it is important. Evaluation is extremely important because a company needs to know whether a program is working or not. So here I have 3 techniques. For one, I have goal planning. So we will have the employer set a list of goals after receiving the results of their health screening and talking to their health coach. The goals must be specific. If the employer is able to accomplish the goals, they receive a bonus. This will help the company determine if progress is being made and if the on-site coaches and clinic is effective. Goals can include cardio at least 30 minutes a day, losing 5 pounds by a certain date, and etc. We will also have the employees fill out questionnaires and surveys to ensure that the health coaches are providing effective guidance, and make sure that the coaches and staff at the clinic are effective and helpful. We will also have frequent health assessments. The wellness of an employee who uses a health coach needs to be continuously tracked, and this leads to frequent health assessments. This type of data collection can illustrate to the company whether their workforce is where they're at or whether they are not progressing. And this also helps the individual themselves because they are able to see where they're at and if they are improving or not. So for this program, I hope that it improves healthier life choices, motivate employers to get people excited about making better choices to promote their health, higher productivity at work, more energetic and better able to manage their stress, increase productivity, which can reduce presenteeism and absenteeism, which is associated with high stress and frequent illnesses, can help identify illness in the earlier stages so employers can get treated before condition gets worse, and helps to reduce healthcare costs, which also reduces stress. So the program benefits, it will reduce outside healthcare costs, establish a community within the company, detect problems early, On-site coaches connect with employers to understand individual needs. On-site wellness coaches have a deep knowledge of subject matter and know what they're talking about. Provides convenient access to high-quality healthcare. Empowers employees to manage chronic conditions. And most of all, help the workplace and the employees feel healthy and lead a happier lifestyle. So my future recommendations, since Nike is already a company that understands the importance of workplace wellness programs and they already have a fitness center that employers can use, they also promote meditation and stable well-being and try to reduce stress. However, in addition to their programs that they already offer, I believe that they should also implement on-site clinics and on-site health coaches to work one-on-one with an employee. This personalized treatment may benefit an employee and help reduce risk of chronic illnesses. Additional recommendations to improve the health at the worksite is create a trusting relationship with the employer and the health coach and ensure that the employers use their complementary services and educate employers on the importance of physical health and well-being. Here's my references. Thank you so much for listening.